Hi, good evening. Steve Adler. Got a minute? Let me go through some numbers. I hope you all had a good Christmas holiday, if that's what you celebrate. It's been a while since we've been together, almost a week. And in the time that, in intervening period of time, the numbers have gotten considerably worse. And right now, Dr. Escott is meeting with County Judge Andy Brown and myself to talk about what we should be doing as a community to try and get a handle on where we are. Dr. Escott this morning was speaking to the media, and he said that we were going to be entering 2021 in an emergency state, a state of emergency. And I want to explain this evening what he meant by that and the numbers that we're taking a look at, because it's going to impact not only what we're calling on the community to do over the next week. It could impact whether what degree AISD schools are open after the first of the year, whether that should be virtual just for high school and middle school, and treating them differently than elementary school. Everything is kind of in play at this point as we continue to take a look at the numbers. But when we were last with each other last week, I pulled the numbers here from 12/21, so a week ago today. This is what the dashboard looked like, and we'll be going through the dashboards tonight, and I'll pull them up on the screen so they're easier to see. I just don't know how to pull up a historical number. But remember that we were just reaching 50 7-day running average for hospitalizations. We were up to 56 7 nights ago. But we had a foreboding number, 537 new cases. The case number was high. You'll notice on the color chart that we were pretty much in the orange area, just beginning to flirt with going up into the red zone, which is the 50 mark that we're talking about. And let me talk about where we were with respect to ICUs and hospitalizations. I want you to remember this number because we're going to look and see where we are tonight. And that's the ICU number. 7 nights ago, just 1 week ago, we were at 84 people in our ICUs. Remember, we went to the hospitals and we said, for planning purposes, recognizing you have ICU beds and you have to keep a certain number of them available for people with heart attacks or car accidents or the like. What's the available space for COVID patients that you can staff? Because it's the staffing component that is our real limiting force. And the hospitals all came back to us collectively and said 200 is the number to use. We've been using that as our planning number. If we go above, if this 84 gets up to 200, then our ICUs are being overstressed at that point. So remember, just a week ago we were at 84 ventilators. A week ago we were at 50. So with those numbers as background, let's take a look at where we are today with respect to those same numbers, and we're going to pull up the charts that we were just looking at, but looking at the ones for tonight. You can see that number that was 50 in the 7-day moving average is now up to 64. The new admissions today, 68, above the 7-day moving average of 74. What that means, rather than just flirting with the red area, you can see in the time that we've been apart, it's been continually moving up to the place where we're 63.7 today. Foreboding still, number of new cases, now 527 new cases today. And that's with our testing being a lot lower this past week. We had been going about 19,000 tests a week. We were about 10 or 11,000 tests this past week because of the holidays. Still had 527 new cases. So all those numbers are of concern. Let's go ahead and stop taking a look at this one, and then let's look at the next dashboard. And this is the one that'll tell us how many people we have in our ICUs to tonight. So we can compare the number. Remember, ICUs. 7 days ago, we were at 84. Today, 132 people in our ICUs. Remember, our limit for planning purposes was 200 staffed ICU beds for COVID patients. And while there's still room in our ICUs, still, if you get scheduled for a procedure, you should go because there's space. But we're on an incline at this point that's making the load in our ICUs we're on a path that we're not going to be able to sustain. That's why a little over a week ago, we started asking people to change their behaviors. We'll talk about that. There's a 2-week lag before we actually start seeing that. So the hope is that we'll see our numbers start going down because of the behavior changes over the last week or two. The concern is that we also fear there might be a Christmas surge peak like there was after Thanksgiving. So if what wins out? The change in behaviors driving down the number, or a possible surge over Christmas because people were gathering? 542 people have passed away in total. The number yesterday was 532. That's 10 people in the last 24 hours that have passed away. Obviously, another considerable warning sign of the danger that we are facing. The reason we are in such an urgent place right now in terms of what we need people to do. Hospitalized folks, 422. Remember that our 7-day moving average is 378. So we're 45 or so over our 7-day moving average. Let's go back and take a look real fast at the University of Texas model. Because that gives us some indications. This again is a website that is publicly available. Let me see if we can pull it up. Here's the University of Texas site. The R factor down to 1.13 had been higher. That's an encouraging sign, maybe, that the people are in the community are changing their behaviors and trying to drive down numbers. But look at hospital admissions. This is the 77 we went to on December 23rd. It's our highest for a while. You can see 68. That's where we are in the last number that we have here. 67 that was yesterday when this model was done. It's up to 68 new cases today. The projection could be any one of these gray lines, but the median is this blue line right here that tells us where we are. The red zone, you can see, was set to go off at 50, and you can see how it's riding. What does that do for total hospitalizations? You can see the number continues to rise based on the projections. We're hoping that there'll be behavior change that'll address that. But look at ICU patients. This scale has us going to 150, 200, which is really our planning limit for staffed COVID beds, probably up at this level here somewhere. This is where we are right now, and you can see how this number's gone up from where we were at 84, and then the number's been rising since then to get to where we are today at the 133, 132 range where we are right now. And this is what the projection is as we move into January. You can see we're getting closer and closer to 200. This is as far as it goes on January 10th. But unless we can change the behavior, unless we can change where we are, this model demonstrates to us that probably the most likely scenario, the mean scenario, has us sometime in mid-January beginning to approach that 200 limit, which is why we really need to kind of change what we're doing. Conversations are going on right now. The biggest risk where we're seeing the greatest number of cases, the extracurricular activities in school. We've talked about that before, and I know Dr. Escott is talking to the schools in the area. The biggest risk we're seeing in the community is social encounters, groups gathering together. Real simply, it's where people get together with other people and they're not wearing masks and not social distancing. Generally speaking, people seem to be wearing masks and social distancing in schools. They seem to be doing it in retail. Seem to be doing it, in many restaurants outside, where that kind of discipline is shown. Except that when you get into a restaurant or a bar, people take off their masks. So any kind of situation where people are taking off their masks present a risk. At this point, with the orders we have in place, with the recommendations, we're generally asking people to except for essential activities, to try to stay home with your family. And if you do go out, make sure that you're wearing your mask whenever you're around anybody who's not in your family. It's those social engagements. It's people getting together in the evenings, oftentimes at people's homes, in groups. They're with their extended family or with their friends. They figure, heck, I know this person. I don't have to put on my mask. That's where we're seeing the infection. So when Dr. Escott and Judge Brown and I get together, we're really focusing on those situations where people gather and they're not wearing masks, because they're not doing that kind of discipline. And that's the kind of thing we're looking at, quite frankly, that probably begins to start taking a look at restaurants and bars. It does not include takeout and carry out and that kind of behavior. And right now we have restaurants and bars that are really hurting in our city. So part of the behavior that you want in a community is not to put people at risk, but also to support those businesses that are really taking it on the chin for the rest of us. If you're able, please let a restaurant cook your dinner. If you're able, do takeout, dine in. If you're able, get gift cards, over tip your wait staff. If you're able to do that. But you can see on this chart what that means for ICU patients and where we would get to the 200 limit. Let me get us back, see if I can get us back to this place. That's why we're focused on the behaviors. And we'll be talking again tonight, talking to the lawyers, talking with each other tomorrow. We're at risk level 5. That means COVID is spreading. It's spreading at an accelerating rate in the community. And we need to do everything we can to protect the doctors and the physicians. I think they may be talking directly to the community this week so that you're not hearing just from elected officials, but you're hearing from some of the frontline people in our community, because they are coming to us right now, asking us to take to you, the community, the request that you do everything you can to minimize risks and our hospitals from being overloaded. The behaviors we're asking people to do: generally stay at home, especially 10:30 at night. Stay with your family. If you go out, wear your mask, social distance if you're around anybody that's not in your home. We are really close to the vaccine getting to people. In fact, it's already started getting to the hospital workers, to nursing home folks, the folks that are most in danger of dying if they get the virus, the people that are voluntarily putting themselves to work with people that are known to be infected, those frontline medical professionals, EMS. Started giving it to first responders and police. We'll get to essential workers, people over 65, focusing on those people that have the physical conditions that put them most at risk. But for right now, what we need to be talking about is, as a community, what we can do to try and keep that ICU number from getting to 200. Please be talking with your friends, please, on social media. I know there are a lot of people some people out on social media that are taking the position this isn't really a serious thing or a deadly virus, or the masking doesn't help. But that's a small group, and it's not backed up by the science. And we're going to continue to be guided by the science. But in your conversations with people, please make sure that people know those numbers you just saw, that we went from 84 people in our ICUs just 7 days ago to over 130 now. This is the conversation we should be having in the community. With that, I want everybody to be safe, take care of yourselves, and good night.